Everyone, good morning to all of you. Today we will go through the same unit, unit 1. Okay, so we have discussed after the expanded career roles. So till this slide we have already discussed in our previous class. Okay, next we'll discuss about healthcare agencies. Okay, so what do you mean by healthcare agencies? Healthcare agencies, or you can say healthcare systems, provide services in different settings. Okay, for example, a hospital may provide acute inpatient services, outpatient clinic, or ambulatory care services, and emergency room services. Okay, so hospice services may be provided in the hospital, in the home, or in another agency within the community, because array of because the array of healthcare agencies and services is so great. Nurses often need to help clients choosing that which best suits their needs. Okay, so clients may be seen by any number, or by any type of nurses and other healthcare providers, which depending on their care. Okay, it's depending on their care and ability to pay for the services. So healthcare agencies which is providing a number of services. Okay, uh, the common healthcare agencies, like including what are all: public health, physician office, ambulatory care center, then general clinic, industrial clinics, extended care facilities, rehabilitation centers, then home health care agencies, daycare centers, rural primary care, hospice services, crisis center, then mutual support and self-help groups. So today we will discuss one by one what are the agencies. Okay, so first we'll discuss about public health. So this is you can say this is a government agency which is established at the local, at state level. Okay, federal means central government. Okay, level, to provide healthcare services. So this is this here the health system is providing services, health facilities to the public. Okay, so next we'll see about the physician office. So it is a traditional primary care center, care settings. Okay, where client usually goes to a physician's office for routine health screening, diagnosis, and treatment. Okay, so especially here what happens, the clients are usually goes to a physician's office for the purpose. Why? For routine checkup. Okay, routine health screening, for diagnosis and for treatment. Okay, so this is known as physician office. Then next one is ambulatory care center. So these centers may or may not be attached to the hospital. So now the term ambulatory care replaced in the term of clinic. Okay, now it's called as clinic. So it provides diagnostic facilities like ambulatory, radiological, medical, and nursing services. So variety types of facilities it has, means now it provides such as laboratory, radiological, medical, nursing services. Okay, so next we'll discuss about general clinic. Okay, so general clinic means those clinics which are refers to a department. Okay, inside or outside the hospital, and which managed by the group of physicians and nurses and other healthcare team. So here the a group of physicians, nurses, and other healthcare team are managing the general clinics. Okay, what happened here, it refers, clinics refers to a department inside or outside of the hospital. Okay, they provide all the preventive, promotive and curative services here in this type of clinic, general clinic. Okay, and then next we'll discuss about industrial clinics. Okay, so industrial clinic, or this agency has been designed for the employees. Okay, those are working in the industry. So today more companies organize the value of healthy employees and encourage healthy lifestyles by providing exercise facilities or coordinate health promotion activities. Okay, so these clinics provide employees with a health screening. What type of health care it provides? Health screening is doing health cleaning, screenings, diagnosis, treatment services, and also caring for employees following injury and counseling. And also counseling. It is counseling. What happens in the industrial clinics, so it is designed specially for employees, means worker, those are working in the industry, in that particular industry. So during any injury or any injury, first aid treatment it's providing. Okay, first aid treatment and referral system also, means here they can, if there is any severe injury happens with a with him with an employee. Okay, so at that time he can, the nurse or the physicians of that industrial clinic, he can refer to the other hospital where every facilities, required facilities are available. So this is the, and what happened here means they are conducting the health you can say health awareness programs for educating the industrial employees, employees worker, for developing how they can develop their health, how they can prevent the diseases. Okay, how they can prevent the accidents in the industry during the working time. Okay, so how they can prevent, how they can limit the accidents. Okay, minimize the accidents. So that type of health. So several health programs are conducted by the industrial clinics. Okay, for preventing the illness and for preventing the accidents. So it helps to improve the health condition of the employees. Okay, so these are the all. So these agencies has been designed for employees, especially for employees. So for the companies recognize the value of healthy employees, and here encouraging the healthy lifestyles. Okay, by providing exercise facilities and coordinate health promotion activities. Okay, so these clinics are providing employees with healthy screening, diagnosis, treatments or several type of treatment services the clinic sorry the industry is providing to their employees. Okay, next we'll see about extended care facilities. So it is also, you can say, known as nursing homes. Nowadays we are calling it nursing homes. Okay, previously it was known as extended care facilities, but now it's known as nursing homes. Okay, so traditionally it has only provided care to clients for all ages. Okay, adult, child and old person. Okay, all ages who require rehabilitation and custodial care. Okay, those are requiring uh, rehabilitation. Okay, rehabilitation and custodial care. So nursing homes, means it has only provided care, only provide care to clients of all age group people. Okay, then next we'll discuss about rehabilitation center. So here assisting client to restore their health. So this center is designed for assisting the clients to restore their health and rehabilitate. Okay, and drug alcoholism, alcohol rehabilitation, drug rehabilitation. Those are addicted person, means alcohol addicted, drug addicted. So here we are treating to them for restoring their health. Okay, we are rehabilitating them. Okay, so this is known as rehabilitation centers. Those type of centers are known as rehabilitation centers. Okay, so next next center or agency, uh, we'll discuss about home healthcare agencies. So home healthcare agencies, this is the implementation of prospective payment and the resulting earlier discharge of client from hospital, have made home care an essential aspect of the healthcare delivery system. So it offers education to the client and also to education to the family. Okay, family, as well as to provide comprehensive care to acute, chronic and terminally ill clients. Okay, so here what happens, the home healthcare agencies are offering education. Okay, education to the client, to the client's family. Okay, for providing comprehensive care to the acute and chronic ill clients. Okay, so educating means regarding about health condition, about their illness. Okay, so here nurses are providing health education, giving health education for preventing the diseases and for what improving their knowledge regarding their health. Okay, health condition. So which leads them to take care of their health. Okay, okay, so this is all about home healthcare agencies. Next we'll discuss about daycare centers. So daycare centers, which provides for infants and children while both parents are working, where both parents, mother and father, are both are working. Okay, nobody is are there to take care of their children. So at that time they are providing, means daycare centers are providing care for their infants. Okay, for their children's also, not only infants, children's also. Daycare centers are providing care to the infants and children's. Okay, so they both parents, while they both parents are engaged with their work, they don't have time to take care of their baby. Okay, so someday some daycare centers provide care for adults. Okay, adults also, some daycare centers are providing health care, who can't care for themselves at home alone but do not need institutional care. Okay, so here means for infants and children's, daycare centers are providing health care, where while their parents are, they both parents are engaged with their work, they don't have time to take care of their baby. Okay, and also daycare centers are providing health care to the adult also. Okay, while adults are unable to take care of their themselves, and also they don't need any institutional care. Okay, any institutional care also they don't need. So at that condition, in that condition, daycare centers are providing health care to the adults also. Okay, so elder care center often provides care including socializing reprogram. Okay, stimulation, counseling, physical therapy. So this type of care, daycare centers are providing to the older person. Okay, elder person, this type of care daycare centers provides to the elder. Next we'll discuss about rural primary care. So rural, that means you can understand, rural means these centers provide emergency care to the clients. Okay, in the rural area. Okay, rural and urban, industrial area are called as urban, and rural, those are village area. So here these centers providing emergency care to the clients in rural area who require stabilization before transfer to a larger hospital. Okay, so usually basic laboratory and radiologic services are also available. So basic basic laboratory test like laboratory and radiologic services like x-ray, yeah, x-ray, usg. So these basic things are basic services are also available in the rural primary care center. But for the further better treatment or advanced treatment, they are sending or they are referring to the other advanced hospital. So these centers are providing emergency care to the client, okay, in the rural area. So those are requiring stabilization and before transfer to a larger hospital. So if they require advanced treatment, then the rural primary healthcare system is referring to the advanced hospital, means and when those where the all facilities which what the patient requirement, okay, according to the patient requirement, all facilities are available to that hospital. The rural primary care center is referring to that hospital to the patient, okay, of the patient. So it is referring the patient to that type of hospital where all the facilities are available according to the patient's need. Okay, next we'll discuss about hospice services. So hospice, it was traditionally a place, okay, or traditionally a hospice was a place for travelers to rest, okay. So before we hospice means we call as a place where we can take rest, okay, where travelers are uh, resting, that is known as hospice. So it provides a variety of services given to the, means hospice services is providing variety type of services given to the terminally ill patient or their families also, and support the patient, okay. Hospice services are providing providing services uh, to the terminally ill patient, to their families, and to the and it also support the person, okay. So it is the program of supportive and palliative services for dying clients and their families that includes physical, psychological, social, and spiritual dimensions of the healthcare, okay. So this is known as this is all about hospice services. So what happens here? Hospice services. What are the hospice services? Here the terminally ill patients are um, taking care, okay, their families and support. I mean, here variety services are given to the terminally ill their families and support person, okay. It is a program of supportive and palliative services, okay, for dying clients and their families that includes physical, psychological, social, and spiritual dimensions of the healthcare, okay. So next we'll discuss about crisis center. So crisis means you can say emergency, okay, emergency services. It provides emergency. Crisis center means what is the role, means it provides the emergency services to the clients experiencing life crisis, okay. So these centers may operate out of a hospital or community. So it provides 24 hours telephone services. So 24 into 7 it is providing healthcare to the emergency patient, okay. So emergency services only it provides. Who provides? Crisis center. So these centers operate out of hospital, may operate out of hospital, out of a hospital or community. It provides 24 into 7, 24 hour into 7, okay, telephone services also. Next, last last agencies will discuss about mutual support and self-help groups. So mutual support and self-help groups, they provide support and comprehensive care to the patient, to the patient or to the people those are having major health problems or health or life crisis, you can say. Okay, so here what happened, mutual support and self-help groups, you can understand by their name. So they provides support. Okay, they are providing support and comprehensive care to the people those are requiring, those are having major health problems and major life crisis. So this type of, this is all about the mutual support and self help groups. Okay, i I think you can learn something from this slide what I taught. So next we'll see about hospital. We'll discuss about hospital. Okay, so hospital means, first we have to know, before going through something, we should have to know about the introduction of that thing. Okay, so we will discuss about what are the introduction of hospital. So the word hospital, which is derived from the Latin word hospitalis, which in turn derived from French word hospice, that means a host or a guest. Okay, so a hospital is a healthcare institution which providing treatment to patients with specialized staff or equipment. Okay, so here hospital are organized institutions for the care of the sick or injured. Okay, so it is the word Latin word hospitalis, which in turn derived from French word hospice, which means a host or a guest. Okay, so it is a healthcare institution which providing treatment to the patients with specialized staff and equipment. Okay, so the in olden days, the hospitals were guest houses, okay, for the shelter of the homeless and for the treatment of travelers. So that's why it's by that the word hospital, which derived the Latin word hospice, which means already said a host or a guest. No, so in the modern times, however, the chief functions of the hospital has been the care and the treatment of the sick. Okay, next we'll, so hospitals are institutions which are mainly designed for care of for the care for the sick, injured and well. Okay, it is the institution, these are the institutions which are mainly designed for care for the sick, injured and well person. Okay, next we'll discuss, next we'll see the definitions of the hospitals. So there are several definitions according to the different organization. Okay, so hospital is an integral part of a social and medical organization, the function of which it is to provide for the population complete health care, both curative and preventive, and whose outpatient services reach out of the family and its home environment. The hospital is also a center for the training of the health worker and for biosocial researches. Okay, it is also a center, you can say, center for the health worker training. Okay, and several researches are occurs in the hospital only. Okay, so according to WHO, World Health Organization, according to WHO, a hospital is an integral part of a social and medical organization, the function of which is to provide the population the complete health care. Okay, providing population the complete healthcare is it's providing both curative and preventive, and whose outpatient services reach out of the family and its home environment. So hospital is also a center for the training and healthcare. So this definition is for who given? World Health Organization given. Okay, then according to so there are several definitions, many definitions according to many according to different centers. Okay, so according to Oxford Medical Dictionary, so hospital is an institution which providing medical or psychiatric care and treatment of patients. It includes residential inpatient, including the care of patients for a whole day and they are returned home at night. Okay, so day care, yeah, day and care, sorry, whole day and they are returned home at night. Outpatient services include consultation with specialists by prior appointment, x-ray, laboratory test, physiotherapy and accident and emergency services for those requiring urgent care. Then according to Stedman's Medical Dictionary, hospital is an institution for the care, cure and treatment of the sick and wounded. Okay, those have wound. Okay, for the study of the diseases and for the training of the doctors and nurses. So what he said, what it saying, hospital is an institution for the care, cure and treatment of the sick and wounded, for wounded person. Okay, so for the study of the diseases, several type of diseases here we are studying. Okay, about several type of diseases, and for the training of the doctors and nurses. Here training also occurs for the doctors and nurses, okay, in the hospital. So according to Stedman Medical Dictionary, this definition given. Okay, so next slide will discuss about community. Community, what do you mean by community and community health? We'll discuss. So before community health, we should have to know about the community. What does it mean? Okay, so a community is a social group determined by geographical boundaries and common values and interest. Okay, so its member know and interact with each other. It functions within a particular structure or exhibits and creates certain norms, values and social institutions. So this statement given by WHO Expert Committee in 1974. So what is the meaning of community? So a group of people in a particular geographical area, geographical boundaries, they are staying togetherly. Okay, and they have common goal. Okay, common, its member know and interact with each other in that area, and it functions within a particular structure and exhibits and creates certain norms. They have some certain norms to follow. They have values, social institutions. Norms here means principles, rules. Okay, in that group, so that is known as community. Okay, next we will discuss about what is the meaning of community health. So before that we will see about what are the characteristics of community. So community has a defined geographical boundaries which has the beginning and the end. Okay, next the boundaries of a small community, boundaries of a small community, the boundaries of a small community such as helmet and village. Okay, sister, you can call it as are distinct, whereas that of a large community also as town, city, etc., are indistinct. Okay, the community is composed, second character is the community is composed of people who live together in the defined boundaries of the community. Then third character is community people have the community people have common psychological characteristics, okay. They are similarity, there is similarity in language, and there is similarity in lifestyle, customs and traditions, okay. They share their common interest, they share their common values, moral norms and codes, okay. So fourth character is, I can say, the people in the community interact with each other and have free communication, they have free communication. Then the community has organized social structure and system and common organization which carry various functions such as housing, food, agriculture, animal husbandry, health, education, marketing, banking, okay. So these are the characteristics of community. Next we'll see about community health, okay. You will learn about you will learn more about community health nursing. You have that subject, okay. Now in your I think second year you have community subject. You will learn more about community health nursing in your in next year, okay. So now we'll discuss about community health only, okay. What does it mean? Community health is health which refers to the health status of the members of the community, to the problems affecting their health and to the totality of health care provided to the community. So it was this statement was given by WHO in 1971. So here community health is defined in a broader way of the community which organized efforts for maintaining, protecting and improving the health of the people, so which involves motivating individuals and families to change patterns of the change change patterns of behaviors and to take such actions including seeking of medical care and would enable them to achieve optimum health, okay. So this is known as community health. So community services, you can say, it is a system that provides health related services within the context of people's daily lives, okay. So that is in places where people spend their time, for example in home, in shelters, in long term care residences, okay, at work, in school, also in senior citizen centers, in ambulatory settings, and also in the hospitals, okay. So it is a system. Community services is a system that provides health related services within the context of people's in their daily lives, okay. We have discussed today about healthcare agencies. Several healthcare agencies are there: public health, physician office, ambulatory care center, general clinic, industrial clinics, extended care facilities, rehabilitation centers, home health care agencies, day care centers, rural primary care, hospice services, crisis center, mutual support and self-help groups. Then we have already discussed about hospitals, okay. Hospitals, it's a introduction, it's a definitions of hospitals, we have already discussed. Then about community, what is the meaning of community, then what are the definition of community, what is the meaning of community health, we have already discussed. Then community services, okay, till this we have already discussed. Then we'll next we'll see about the types and functions of hospitals in the next class, okay. So if you have any doubt you can ask me, okay. Thank you so much, thank you for listening me, thank you, have a good day.